Doctors of Reddit. What is the weirdest thing a patient wouldn't admit? Not a doctor, but a nurse. I had a patient come in with a toothpick in his penis. He refused to tell me how it got there. He insisted he was picking his teeth and it fell in. Ah, the old head on a stick. Nurse here had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote, she never got out of bed. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of the instructions before saying, read the details on the sheet. I've accompanied a blind friend to a medical appointment a couple of times, and doctors are always giving her instructions without reading material to her. When was their last meal? They think they can fool the PET scan. End up losing money, time, and over-irradiated. Once had a woman come in for a possible yeast infection. On the exam, she had a glass bottle stuck in her vagina filled with urine. Totally wouldn't admit it was hers or explain how it got there after we removed it. Just kept saying, "I think this is all a joke and you put it up there." Yeah, she was totally trying to cheat a drug test. Definitely. The bottle had an overly complicated apparatus that allowed her to discreetly trigger the urine to come out, which made it all the more weird when she pretended we hadn't just pulled CIA tech out of her cooch. You weren't breathing. We gave you Narcan. You started breathing again. Woke up. And then deny you used a narcotic. Yeah, alright. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed a pen in his small bowel, and we took the pen out during an emergency surgery. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago? Not a doctor, but a nurse. When you come to the hospital wanting a detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you're not having a seizure. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird. And awkward. Maybe his wife really likes Pepsi. Only worked at records in a clinic, but we had a woman come in with a report of vaginal odor. All well and good. It happens all the time in an OBGYN clinic. What she hadn't bothered to mention was that she had gotten a tampon stuck around the end of her last period. She had gone through menopause 7 years prior. I want to make sure I'm understanding this clearly. She had a tampon stuck in her vagina for 7 years. I didn't go into her chart, but according to the medical assistant that was in the room, the rest of us needed no more proof than what our noses found in the hallway. Ah, the swamps at Dagobah. I had a woman on my OBGYN rotation during med school that had pelvic inflammatory disease with bilateral abscesses around the fallopian tubes requiring drainage and IV antibiotics. The cause? Well, she never admitted to it, but we believe that she was repetitively using unwashed sex toys to pleasure herself for weeks based on the culture that grew and her story not adding up. Not a doctor yet, but was volunteering on the emergency ward, and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. How do you guys stay sane when dealing with stuff like this? Dark humor, from what I've heard. I was pretty shaken after a car accident burn victim, so my fucking boss ordered barbecued pizza for the floor. AmVed student.
I don't overfeed my dog/cat. That's just their normal size.
When their pet is shaped like a watermelon. Having sex. They were pregnant. Nurse here. Patient denied she had ever pooped. Like, at all. When she said that, I gave her the most dumbfounded look. It's a natural function. You would literally be dead after a relatively short period of time of severe pain and discomfort. Incessant nausea and vomiting if you didn't poop. Come on.
Oh my god, that is epic.
That all 3 times he had been to the ER for a can of shaving cream in his rectum was because he had slipped and fell in the shower. Well, let's be realistic. Where else but the shower would you slip a can of shaving cream up your rectum? Not a doctor here, but my dad is a gynecologist, and had someone take a shit in his garbage, and he casually asked them if it was them, and if they needed help, and they were adamant it wasn't them. SNL Appalachian Emergency Sketch Series immediately came to mind when seeing this post. Had a man forget about foreign object in his rectum for 6 days. Came in complaining of constipation and abdominal pain. 5 minutes after the x-ray, remembered something might be up there. They got bitten by a spider inside their mouth because they enjoy eating live insects found inside their house. Patient came in with a spider bite in their mouth. Clearly they had been eating insects since childhood. Not a doctor, but a nurse. I had a patient that kept giving herself chlamydia repeatedly from using her vibrator when she had been infected from a random partner. We asked her about any other partners or toys, etc. She denied until she couldn't anymore. Why not just clean the toy? Agreed, I know. Nurse here. We frequently get patients that have fell on whatever object is lodged in their rectum. Like, I don't care that you shoved a pillar candle up your bum for fun. But why are you lying about it? Own your kinks. That the Rolex inside his rectum was his and that he put it there. I'm only a nursing student. How was I supposed to deal with this? I came up to the charge nurse. Excuse me, but... And the nurse interrupted me. Oh God, what'd he stick up there this time? I said, a watch. How do I take it out? Gingerly. Not me, but my wife. She had a patient who stuck a toothpick in her ass. She refused to admit she got it stuck up there for God knows what reason, and insisted she accidentally ate a toothpick, and it traveled, intact, through her digestive system and got stuck in her butt. Not a doctor, but an x-ray tech. Patient came in saying he couldn't piss. Took an x-ray to find a snake in his bladder. Apparently, he fell asleep with his snake in his room and it crawled right in. Wait, what's the diameter of a snake? And the diameter of a urethra? Something doesn't seem to add up. How many sexual partners they have or had. Often they seem startled as though why I'm even asking at all when the chief complaint is vaginal discharge. An older woman with a stoma where a colostomy bag is attached, with what appeared to be a herpes flare-up around it. She had flat out refused to admit she had been doing the old Philly sidecar, but there's no denying that bit of evidence. I once heard the term Philly sidecar and didn't look it up. You have now answered that for me, and I wish I still didn't know. 22-year-old male. Broken nose. Cracked ribs. Black eye. Refused to admit his mother beat him up until the police appeared in the emergency room and charged him with stealing jewelry from his mother. Why is it normal to shove items in your ass or mouth? What the fuck? So you're saying shoving food in your mouth and cleaning your arse with toilet paper is weird?
Lol.
More like the other way around. I'm just checking for the doctor who saw the spider eater from Tifu. Yeah, this guy came in for a spider bite in his tongue and tried to sell me this crappy story about eating a piece of fruit with a live spider on it. Great protein levels, though. Warning, this is gross, not a doctor, but a nurse. I once heard this story of a patient who came in with an infected stoma on their ostomy. Turns out, her husband enjoyed having sex through her stoma. Not a doc, but I worked in a facility that included drug recovery. One client would not admit their last time since cocaine use. But over time, the client was clearly coming off a coke binge and first stated 3 days ago, which turned into 5 days, which turned into 2 weeks, and ended with, I don't know, it's been months. Stop with the meta eating a spider comments. Nurse here. Patient had shampoo bottle, not travel sized, in his anus. Kept saying he slipped in the shower and accidentally fell on it. Sounds maybe funnier than getting it out of him.